Hello, beautiful people. It's Steffi B, and I'm here to study with you guys today. Today's topic is going to be renal and urinary system. So we're going to go ahead, we're going to get started, and we are going to do 10 questions. All right, let's go. Question number 1. A client with acute kidney injury has a serum potassium level of 7.0. The nurse should plan which actions as a priority. Select all that apply. 1, place the client on a cardiac monitor. 2, notify the healthcare provider. 3, put the client on NPO status except for ice chips. 4, review the client's medications to determine if any contain or retain potassium. Or 5, allow an extra 500 milliliters of intravenous fluid intake to dilute the electrolyte concentration. So the answer here is number 1, number 2, and number 4. So why are those the answers? Let's go to the question. What are they asking us? What information did they give us? So they're asking us, what should the nurse do? What is the priority action if you're given a potassium level of 7.0? So first we need to know our normal potassium level, which is 3.5 to 5. So we know that this level of 7.0 is elevated. So we are looking for an intervention that we want to do when we see a potassium level that's elevated. So let's look at our options. Number 1, place the client on a cardiac monitor. Yes, you want to put them on a cardiac monitor because if their potassium level is above 5, they are at risk for cardiac dysrhythmias and a cardiac arrest. Right? So you want to see what's going on with their heart, so you put them on a cardiac monitor. Number 2, notify the healthcare provider. Yes, right? So this is an emergency, right? If their potassium is high, you want to let the doctor know. So notify the healthcare provider. Yes, you don't want them to go into a cardiac arrest. Number 3, put the client on NPO, nothing by mouth, except ice chips. No. That's not going to affect their potassium level. That's not really fixing the problem, right? So the problem here is that the potassium level is elevated, right? So we're looking for interventions of what we would do for that problem. So if we give them nothing by mouth, it doesn't really address the concern and the problem of an elevated potassium level. Number 4, review the client's medications to determine if any contain or retain potassium. Yes. We want to look at their medications, right? We want to see what they're taking and we want to see if there's potassium in it. And that is because we don't want that potassium level to go higher, right? We don't want it to get elevated even more than 7.0. It's already elevated. It's already a concern, right? So that is an even bigger complication that we want to avoid. So number 4 is the correct answer. Number 5, allow an extra 500 milliliters of IV fluid intake to dilute the electrolyte concentration. No, we don't want to do that because we don't want it to contribute to fluid overload, right? So that can be a complication and it would only drop the potassium level not that much. It won't be a significant decrease, right? It would just be another problem to address with fluid overload. Right, so here specifically, we're focused on the elevated potassium of 7.0. So what do? We put them on a cardiac monitor, right? So we can assess the rhythm. We call the doctor, we let them know, and we look at their medications, right? So we want to make sure that they're avoiding any excess potassium. So here the answers are 1, 2, and 4. Number 2. The nurse is assessing the patency of a client's left arm arteriovenous fistula prior to initiating hemodialysis. Which finding indicates that the fistula is patent? 1, palpitation of a thrill over the fistula. 2, presence of a radial pulse in the left wrist. 3, visualization of enlarged blood vessels at the fistula site. Or 4, capillary refill less than 3 seconds in the nail beds of the fingers of the left hand. So the answer here is number 1, palpation of the thrill over the fistula. So why is that the answer? Let's go to the question. In the question, they're asking, what indicates that a fistula is patent? There's two ways to tell if a fistula is patent. The first way is by palpating a thrill. The second way is by auscultating a bruit. Now, let's look at the options. So number one, palpating a thrill. What does that mean? So when we palpate a thrill, we're feeling for a vibration sensation, okay? And a fistula is a surgical connection of the artery and the vein. And this is done usually if there's trauma, if someone's getting dialysis. There's several reasons why this is getting done. But the most important thing when somebody has a fistula is patency. So number one is correct. Number two, presence of a radial pulse in the left wrist. That's great. That's awesome, right? We want to check our pulses and everything, but it doesn't tell us if the fistula is patent, right? It just tells us that there's adequate circulation, which is cool. That's good to know. Number three, visualization of enlarged blood vessels at the fistula site. Okay, so this is a normal observation, but it doesn't indicate patency of the fistula, so this would be incorrect. And then number four, capillary refill less than 3 in the nail beds of the fingers of the left hand. That's great. That's what we want, right? So that also shows adequate circulation, right? If we're checking our nail beds and it's less than 3 seconds. But it doesn't tell us that the fistula is patent, right? There's only two ways, right? The first one, palpating a thrill, feeling that vibration, and auscultating a bruit, which is like a turbulent swooshing sound of that blood flow going through the fistula. So here the answer is number one. Number three, the nurse is monitoring a client who has just returned from surgery after a transurethral resection of the prostate. The client has a 3-way Foley catheter in place for ongoing bladder irrigation. The nurse is observing the color of the client's urine and should expect which urine color during the immediate postoperative period. 1, pale pink urine, 2, dark pink urine, 3, tea-colored urine, or 4, bright red blood with small clots in the urine. So the answer here is number 1, pale pink urine. Why is that the answer? Let's go to the question. What are they asking us? That's the most important thing that we need to ask ourselves, right? So we know what to look for. So in this question, they're asking, the nurse is observing the color of the client's urine. So what should we expect, right? Immediately after a TURP surgery, post-op. So we would expect number 1, pale pink urine. Right? So let's look at number 2, dark pink urine. If we see dark pink urine, that means that we need to increase the irrigation solution. Okay, let's look at number 3, tea-colored urine. We wouldn't see tea-colored urine. Usually we would see tea-colored urine if somebody is going through renal failure, right? That's when we would see tea-colored urine. And then number 4, bright red blood with small clots in the urine. No, we would not see this. We don't want to see this, right? So this is a complication after a TURP surgery, right? So if we do see this, we want to contact the healthcare provider right away, right? Because this is a complication and this is something we don't want to see. And if we see it, call the doctor, right? So here the answer is number 1. Number 4, a client has developed acute kidney injury as a complication of glomerulonephritis. Which should the nurse expect to observe in the client? 1, bradycardia, 2, hypertension, 3, decreased cardiac output, or 4, decreased central venous pressure. Here the answer is number 2, hypertension. Okay, so why is that the answer? Let's go to the question. In the question, it's asking, what would we see in a client that has acute kidney injury, specifically glomerulonephritis? So with that information, we should know what type of kidney injury they have, right? Because there's a pre-renal, an intrarenal, and a post-renal injury to the kidneys. So in this question, we know with glomerulonephritis, that is an intrarenal injury, right? So with glomerulonephritis, that is inflammation of the glomeruli, right? And that's where the filtration happens in the kidneys. So if you have an issue filtering things out in the kidneys, you are gonna have a backup of waste products, right? You might have excess fluid, right? So you wanna think of signs and symptoms of fluid overload to answer this question. So number 2 would be correct, right? Hypertension. Okay, you would see tachycardia, you would see edema. Let's look at the other options. So you would see tachycardia, so it would not be bradycardia, so number 1 would be incorrect. Number 3 and number 4, decreased cardiac output and decreased central venous pressure. What is that describing? That is describing issues with the pre-renal stage, right? The pre-renal injury. So what that means is there's issue with perfusion, right? So the pre-renal is poor perfusion, right? And then intrarenal is injury directly to the kidneys. And then post-renal is after the kidneys. So here the answer is number 2, hypertension. Number 5, a client with an arteriovenous fistula in the left arm who is undergoing hemodialysis is at risk for infection. Which should the nurse formulate as the best outcome goal for this client problem? 1, the client washes hands at least once per day. 2, the client's temperature remains lower than 101 Fahrenheit. 3, the client avoids blood pressure measurements in the left arm. Or 4, the client's white blood cell count remains within normal limits. So the answer here is number 4, the client's white blood cell count remains within normal limits. Why is that the answer? Let's go to the question. In this question, we're looking for the best outcome goal for a client that has an arteriovenous fistula in the left arm that's at risk for infection. So we want a goal that's going to address the risk for infection. Okay, let's look at the options. So number 1, a client washes hands at least once per day is not a good goal, right? So yeah, washing our hands is great. That's awesome. A great preventive measure that we want. Definitely more than once per day, right? But there's a better answer than number 1. Let's move on. Number 2, a client's temperature remains lower than 101 Fahrenheit. That's great, right? We want their temperature to be lower than 101 Fahrenheit, right? But there's another answer that indicates an infection, right? So we want to choose a different answer. So let's move on. Number 3, the client avoids blood pressure measures in the left arm. Yes, we do want to do this. This is a correct answer, right? But this question is asking specifically what is the best outcome for a risk for infection, not a risk for injury, right? Because that can cause injury doing a blood pressure measurement on the arm that they have an arteriovenous fistula. Number 4, a client's white blood cell count remains within normal limits. Yes, that is what we want, right? So we want to look at their white blood cell count. So that will tell us whether they have an infection or not, right? So that is the best indicator. So that's the best goal for a client that's at risk for infection. So here the answer is number 4. Number 6. The nurse is giving general instructions to a client receiving hemodialysis. Which statement would be most appropriate for the nurse to include? 1, it is acceptable to eat whatever you want on the day before hemodialysis. 2, it is acceptable to exceed the fluid restriction on the day before hemodialysis. 3, medication should be double dosed on the morning of hemodialysis because of potential loss. Or 4, several types of medications should be withheld on the day of dialysis until after the procedure. The answer here is number 4. Several types of medications should be withheld on the day of dialysis until after the procedure. Why is that the answer? Let's go to the question. So in this question, we're looking for a statement that's most appropriate for a client that's going through hemodialysis. So what statement is appropriate to give this client, right, for instructions? Number 4 is the answer because there's many medications that are going to be extracted from your bloodstream, right, during hemodialysis. So there's going to be several medications that are going to be withheld. So 4 is the right answer. Number 1, it is acceptable to eat whatever you want. No, you can't eat whatever you want because if your kidneys are not working, you're going to have a backup of waste products, right? So if you eat more food, you're going to have more waste products built up in your system, right? So you do not want that, right? So you're going to be on a specific kind of diet. So number 1 is not the answer. Number 2, is it acceptable to exceed the fluid restrictions? No, you cannot do that, right? You want to be on those fluid restrictions because your kidney is not functioning normally, which means it's not filtering normally. If it's not filtering normally, you're going to have a backup of waste products and fluid, right? So you're going to be at a higher risk for fluid overload. So you do not want to exceed and have more fluids. And then number 3, medications should be double dosed. No, because we can't tell how much of the medication is cleared by dialysis. So no, we do not want that. So here the answer is number 4. Number 7. A client undergoing hemodialysis is at risk for bleeding from the heparin used during the hemodialysis treatment. The nurse assesses for this occurrence by periodically checking the results of which lab test? 1, bleeding time, 2, thrombin time, 3, PT, or 4, PTT. So the answer here is number 4, PTT. So why is that the answer? Let's go to the question. So in this question, it's asking, what lab would we assess for a client that's receiving heparin? So the way that I remember it is if you put the 2 T's together, it looks like an H for heparin. So guys, just remember, heparin, PTT, okay? And then for warfarin, it's PT. So here for this question, the answer is number 4, PTT. Number 8, the nurse has administered a dose of meperidine hydrochloride to a client with renal colic as treatment for pain. The nurse carefully monitors this client for which side and adverse effect of this medication? 1, bradycardia, 2, hypertension, 3, urinary retention, or 4, increased respirations. And the answer here is number 3, urinary retention. Okay, so why is that the answer? Let's go to the question. So that is the first place where you want to start, right? So we need to know what they're asking so we know what to look for. So in this question, they're asking, what should we monitor for a side or adverse effect for this medication? So this medication is meperidine hydrochloride for pain. So with this medication, this is an opioid analgesic. So for that drug class, that is going to suppress your respiratory system, right? So let's look at the options. So for number 1, you would have tachycardia, right? So your heart would be racing, right? So you would not have bradycardia. Number 2, you would have orthostatic hypotension, not hypertension, right? Number 3, yes, you would have urinary retention. And then number 4, you would have respiratory depression, right? You would not have increased respirations. Okay, you would have drowsiness, mental clouding, constipation. So those are the symptoms that you would see with that medication. So for this question, the answer is number 3. Number 9, the nursing student is caring for a client with benign prostatic hyperplasia. The nursing instructor asks the student to identify the clinical manifestations associated with this condition. The student needs further teaching if the student states that which finding is an early symptom of BPH. Is it 1, nocturia, 2, hematuria, 3, decreased force of urine stream, or 4, difficulty initiating urine stream? So here the answer is number 2, hematuria. Okay, let's go to the question. So in this question, it asks which one needs further teaching for an early symptom of BPH. So we are looking for the wrong answer. So 3 answers are correct, showing early signs of BPH, and 1 is incorrect. And that is the answer that we're looking for. Let's go to the options. So 1, 3, and 4 are early signs of BPH, right? So 1, nocturia. So frequency of going to the bathroom at night. Yes, you will see that if you have BPH. Number 3, decreased force of urine stream. Yes. Number 4, difficulty initiating urine stream. Yes, so those are all symptoms that you would see. One symptom that you would not see is blood in your urine. So hematuria, yes, you would not see that. So, and you don't want to see that, right? So here the answer is number 2. Number 10, a client being discharged home after renal transplantation has a risk for infection related to immunosuppressive medication therapy. The nurse determines that the client needs further teaching on measures to prevent and control infection if the client states that it is necessary to take which action? 1, take an oral temperature daily. 2, use good hand washing technique. 3, take all scheduled medications exactly as prescribed. Or 4, monitor urine character and output at least 1 day each week. So here the answer is number 4, monitor urine character and output at least 1 day each week. Why is that the answer? Let's go to the question. That's where we start. So in this question, we are looking for something that needs further teaching. So something that is incorrect, right? So a statement that's showing that they don't understand preventative measures for infection, right? So 3 answers are correct, 1 is incorrect. So let's look at the options. Number 1, take oral temperature daily. Yes, you do want to do that, right? So that does show whether somebody has an infection or not, right? And also, if they're on immunosuppressive medication therapy and they're on corticosteroids, that masks symptoms of infection, right? So we want to look for ways to look for infection even more by taking their temperature. So yes, number 1 is correct. Number 2, yes, we do want to wash our hands. So good hand washing technique is important. That is correct. Number 3, yes, all scheduled medications exactly as prescribed. We always want to take medications as prescribed, right? We do not want to play doctor, right? Because we are not doctors. We don't know what's good for us, what medications we need. We go to the professionals, right? So we take medications exactly as prescribed. Number 4 is incorrect. Why? Because we want to monitor urine character and output daily, right? If somebody's on immunosuppressive therapy, they're immunocompromised, they're at a higher risk for infection. We want to monitor them daily, right? That is important. They need to be assessed daily. So here, the answer is number 4. All right, guys, we are all done with the 10 questions on the renal and urinary system. Thank you for studying with me. Guys, thank you for being focused, doing what you gotta do. Guys, if you wanna show some love, like the video, leave a comment, that would be awesome. It's good to know if you guys do like the video, if I should keep making more videos. I don't know, just let me know what you guys think, that's important. And guys, keep going, it's worth it, trust me, it's worth the stress and everything like that. But don't forget, self-care is important, and guys, good luck, okay? Bye, beautiful people.